Bismillahirrahmanirrahim. Distinguished Coordinator General of YC comstech, Distinguished Advisor of Science Policy STIC, Honorable Speakers and Honorable Participants. A very good afternoon to you all and Assalamu Alaikum. I am Rakibul Hassan, working as a Junior Program Manager at YC comstech. It's my privilege to welcome to you all, including policymakers, researchers, academicians, students and experts from YC member states and other regions. Without further delay, let me invite to you all to join me for the official opening of this webinar, beginning with recitation of Holy Quran.
أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. الرحمن علم القرآن خلق الإنسان علمه البيان. الشمس والقمر بحسبان والنجم والشجر يسجدان والسماء رفعها ووضع الميزان ألا تطغوا في الميزان وأقيموا الوزن بالقسط ولا تخسروا الميزان. صدق الله العظيم.
Now I would like to invite Her Excellency Professor Dr. Mudassir Asrar, Advisor of Science Policy and STIC at YC comstech, to deliver the welcome remarks on behalf of His Excellency Professor Dr. Mohammad Iqbal Chaudhary, Coordinator General of YC comstech, Mustafa Prize Laureate and a distinguished national professor. He is currently unable to join us due to his busy schedule. Ma'am, the floor is yours.
Thank you very much. Bismillahirrahmanirrahim. Distinguished speakers, colleagues, and dear participants, I on behalf of OIC comstech, warmly welcome you all to this important webinar on artificial intelligence applications for ecosystem resilience and in the context of One Health approach. We are here today to explore a pressing challenge: how to strengthen the resilience of our ecosystem and how this directly shapes our biodiversity and the environment. The increasing frequency and intensity of extreme events have highlighted the need for a unified approach known as One Health. This brings together many disciplines to address health issues holistically. The artificial intelligence has emerged as a transformative force. Its applications spans across diverse domains, from academic surveillance and early warning systems to precision agriculture, biodiversity monitoring, and climate modeling. AI enables us to analyze complex data, anticipate outbreaks, optimize interventions, and design resilient systems capable of adapting to climate and health shocks. In fact, AI equips us with powerful tools to build a healthier, smarter, and more sustainable future. For OIC states, particularly those in the global south, this is not merely a scientific or technological matter. It is a question of survival and development. Our nations often face the harshest consequences of climate change and environmental disruption while possessing the fewest resources to respond. This reality underscores the central mission of comstech to strengthen scientific and technological capacities across the Muslim world, transforming shared challenges into opportunities for innovation, cooperation, and inclusive socio-economic growth. I'm truly delighted to see so many distinguished experts, scientists, and policymakers joining us today. Your knowledge, experience, and insight will enrich our understanding of how AI can support the One Health framework and enhance ecosystem resilience. Together, we can bridge knowledge gaps, foster collaboration, collaborative research, and ensure that emerging technologies are harnessed responsibly and equitably for the service of humanity and protection of our planet. I look forward to the fruitful discussions ahead, and I am confident that the insights and collaborations generated here will continue to inspire progress well beyond this session. Thank you very much once again for joining us here.
We thank Her Excellency Professor. We thank Her Excellency Professor Dr. Mudassir Asrar ma'am for those inspiring welcome speeches which remind us of YC comstech's ongoing commitment to scientific and technological cooperation among YC member states. Now I would like to invite our distinguished speaker, Professor Dr. Khandakar Abdullah Al Mamun from Department of Computer Science and Engineering at United International University, Bangladesh. He is also working as the Director of Masters in Computer Science Engineering Program and the Institute of Research Incubation and Commercialization to deliver his presentation on AI application for ecosystem resilience. He is well known as a leading expert in applying AI, big data, IoT, and brain-computer interface to healthcare and education. He also founder of CMED Health, whose innovations have benefited millions of people. Sir, the stage is yours.
Hi, good afternoon. Is I'm audible?
Yes, sir.
Okay, and also my skin is visible?
Yes, sir.
Okay. Thank you so much. Distinguished guests and other dignitaries and audience, thank you so much. And I'm grateful to the YC Comstech for inviting me to deliver my talk on AI application for ecosystem resilience. So we all actually very much familiar with AI, and every day we use AI from basic voice assistance in our smartphone to we know there is a driverless car in Los Angeles that people use every day. So artificial intelligence is a new form of intelligence that actually augmenting the human. So AI, we also think AI could be a new phenomena that happened last few years, but actually not. AI actually started its journey 70 years ago in around 1950. However, due to the complexity of human innovation and AI transformations and solving a complex mathematical problems, the success of AI was not that much efficient in the beginning 50 years. However, with a true boom around 60s and around 80s, that after 2000, the AI actually boomed its unconditional progress, which we could say exponential growth. And the person behind this current AI transformation, which known as godfather of AI, and also got the Nobel Prize in physics for AI transformation, Geoffrey Hinton. And he made AI possible today. I'm very fortunate that I had the opportunity to work with him while I was working as a scientist at University of Toronto, Canada. So I just would like to share with you very basic transformation that we experiencing last 30 years. If we think about it, 30 years ago, if we want to do the financial transaction in the bank, it was a cumbersome approach, very paper-based, traditional, and if you want to withdraw a money from the bank, it's going to take 3 to 4 hours. On the other hand, around 25 years ago, when ATM machine actually came to us, and we found that that whole process is less than 5 minutes. And now we're using mobile financial service, and where we can actually transfer money within 5 seconds. Now I would like to share with you how AI transformation is happening. Again, I would like to use the experience and example of while we are in university education. 30 years ago, there is no AI, there is no internet that much penetrated. We need to go to the library, spending the whole day and capture the knowledge and gain the knowledge and summarize the knowledge. On the other hand, when Google search engine came, which is an AI search engine and which make our life efficient, that is 8 hours job could be happen in 2 hours. Now we are living in era of ChatGPT, where ChatGPT is making our life much easier. Any information we want, we can get less than a minute. So this is the transformation of digital and AI we are experiencing and getting the benefit of it. So now we are living in the era of fourth industrial revolution. In the fourth industrial revolution, AI is the driver for everything. However, there is other technology that also influence AI to solve many problems in our society, in our region, and around the world, which includes Internet of Things, sensor-based data capturing, blockchain, which actually help us to actually capture the data in a ledger, and one day maybe we are using the dollars or current paper-based currency. One day all the currency will be digital through blockchain. Robotics, we know that there is a risky job. We can do the robotics. 3D printers help us to simulate or develop anything we want. Augmented reality and virtual reality will help us to do the medical education much better, to do the science education much efficient. And genomics, that lead us to precision medicine, to understand beforehand who have a risk of cancer or the developing cancer. And big data will help us to understand many things based on making a data-driven decision. And also data need to be stored in the cloud, and here also give us a lot of opportunity. 5G is another thing that help us to do the remote surgery on real time without a single millisecond delay. And we want a greener future, which also have a renewable energy. And the future is not only AI, quantum computing is knocking our door. All of these things will benefit the humanity and the world. I just would like to share with you what is happening in the AI arena. You might know about the driverless car is now reality. If you actually in the Los Angeles, if you need a Uber, you just get an Waymo that comes to you and you can enjoy the ride. There is no driver in there. So China, USA is actually ahead of the game. When it comes to the information, ChatGPT, we all know we are using ChatGPT, Gemini, but another one is DeepSeek is also developed in China. I'm just showing that how every country is progressing. When it comes to the healthcare of AI, that Google is developing Google Health for predicting diagnosing lung cancer. There are Q.AI, which comes from India. And we would like to proudly say that in Bangladesh, we developed Sushastra AI, an AI-powered personalized healthcare system that can predict your health risk and manage your health management from reactive care to proactive care. So in agriculture, similarly in Japan, UK, China, they are actually taking the advantage of it. And when it comes to the education, in education, Khan Migo from the Khan Academy in USA, helping like a better than a tutor that teaching the kids in the school or college level. And there is a Duolingo is another solution for testing and learning English. In China, Squirrel.ai is also another example. So why I'm showing all of these things, it shows the power of AI that transforming the education, health, transportation in every developed country. And why we need AI. AI actually solve complex problem more faster and smarter ways. And AI will replace the repetitive jobs. And AI will bring productivity, efficiency, more accuracy and transparency. I just would like to share with you the market of AI in next 5 years will be $15 trillion. Now the question is how to build AI. So what powers AI? AI need three basic things. It's called the data. We are the country in the OIC have a huge populations. We generating the data every day. We need to capture this data to train our AI models. AI models is available. We have to train it on our own purpose. And AI model need data and as well as computational power, which is not very difficult to achieve. So these three things help us to build our own AI capacity. Now, when I'm talking about the $15 trillion, in USA, they already invested around $500 billion in AI, and they committed another $500 billion. And every country, if I list here, China, UK, Canada, every country already hugely investing in AI. Now, question is how OIC countries are doing. We need to think about it. So AI also in education. So in China, they actually made it mandatory to learn AI at the grade 6. And in USA, UK, and many countries, they started AI learning in the school levels. Again, we have to question ourselves, what are the role of OIC countries? They are adopting AI in the educations. I'm talking about a lot of good things about the AI, but we have to remember every technology comes with a good or bad part. So if we don't regulate any technology, that technology could be harmful for us. Therefore, we need to regulate AI. AI could heal us, AI could kill us. So therefore, every country need to design the regulation to use the advantage of it and reduce the harmfulness of it. Now my question to every audience and distinguished guest, where OIC countries are in the arena of AI? So to my knowledge, we are still at the primary stage. We are very limited to very basic things. We need to take the advantage of AI. So therefore, like myself as a citizen of OIC countries, I have to question myself and everyone. I'm asking you all, we have to decide, we want to be user of AI or a creator of AI. We be the consumer of AI only, or we should be the innovator of AI from the OIC country as a citizen. We should build our own AI model, or we should depend on the other countries' AI model. Should we import all the AI solution from the other countries, or we OIC country people build our own AI for our regional collaboration so that we can solve our problems? And I believe the OIC countries have the huge potential and the brain and the intellectual to build their own AI to sharing their own countries and exporting as well. So if we don't act on it, we will be colonized like previously. In many foreign countries will develop AI and they will colonize us and we will depend on them. So we have to question ourselves that what will be our role. So this is my way forward I would like to share with you. In OIC countries, we have to emphasize on innovation, efficiency, and artificial intelligence and fourth industrial revolution technology utilizations to solve our problem of corruptions, inefficiency, public service delivery, creating access to healthcare, education, better agriculture, better transportation management, better financial service, energy management, and early disaster as well as pandemic. So now I urge to every OIC countries and the policymakers to focus on as soon as possible creating the AI policy on their own country, creating the AI strategy, and creating the AI regulation. As I said, AI have a good part and bad part, and which create the new landscape for precision, better agriculture for their productivity and agricultural safety, food safety, and creating healthcare in a much better way so that you can create from the current reactive healthcare to proactive healthcare and managing the healthcare cost and disease burden, and also better education and skill development for next generation of AI ready human resource development, creating better public service, reduce the corruption and bring the efficiency and better citizen service, and of course saving the environment, creating the green energy and better management of energy and mineral resources. So now I would like to share with you a few things about the understanding of One Health approach. We all know One Health involves human, animal, and environment, all are incorporated. It brings together our human health, veterinary health, environment, and the policy together. So our ultimate goal to achieve optimal health outcomes for people, animals, and planet, and it should be our shared responsibility. So now, what are the challenge and pandemic we will face, and are we prepared for it? Our emerging zoonotic diseases will have a huge influence that we already faced COVID-19. We know that. Climate is one of the serious issue, and biodiversity we are losing due to inhabitants of our natural need. And antimicrobial resistance will be the big things in 2050. It is saying that misuse of antibiotics, it will be a next pandemic in 2050. Our fragmented health system and other system, agriculture, water, land, all are not talking each other. So we are not prepared now. So we have to prepare, especially in OIC countries and LMIC countries. So how AI will help us to do the surveillance, early detection of many situations, disasters, pandemic, and so on. So we need to use that, capture the data, and data will give us predictive analysis. We can use AI model for emerging disease patterns from animal, human, and environment. We need to do the regional, countrywide, and beyond the country surveillance system, use machine learning, which is a part of AI, for monitor our news, social media, health report, and also monitor our environment to ensure that how can we mitigate the climate challenges and other pandemic situations. And of course, epidemiology should be more optimized. We can use precision epidemiology, which is AI integrated, multi-source integration from genomics, mobility, weather, and so on for forecasting. And AI for also for response, research, and policy. AI and the data will help us to make the better public health decisions, allocate our resources to better manage for multi-stakeholders, One Health data platform and regional cooperation and management, because pandemic has no boundary. So that's why our drug discovery, vaccine management, prevention need to be in place. And most importantly, AI will help us on the education of managing very much communicable disease and spread. So we need to build our shared future. Is not one country. In our Islam, our Prophet said, if you never is not having a good life, you should not have a good life. So every country need to cover each other. So One Health is not a theory now. One Health is a teamwork for our sustainability, and we should create our regional ecosystem for managing these things and contributing and involving every sector for our collective prevention, and which is cheaper and smarter rather than crisis response management. So we call it investing in One Health, investing in resilience, food safety, and our security. So what I would like to say, that next outbreak will not take just our systems, but our solidarity, our ecosystem, our collective approach. So the time to prepare is not when the virus hits, is now to proactively work together. Let me just share a few minutes about our work, what we do at our institute, which is called Institute of Research, Innovation, Incubation, and Commercialization, where we call it that we solve problems and we generate idea to product, service, and commercializations. In our organizations, we have more than 100 people who are working the technology like AI, data science, brain-computer interface, robotics, automation, augmented reality, and virtual reality in the application of health and well-being, education and skill development, energy industry and business, agriculture and climate. So we actually want to share with you, we build an healthcare systems which is a proactive rather than reactive, which is an AI-powered, health worker-driven, people-centered model to reimagine primary healthcare in every LMIC countries. So let me show you a video that will help you to understand how AI is transforming the healthcare in every country.
Healthcare is a fundamental right, but in many LMICs, lack of access to healthcare and delayed diagnosis result in overcrowded hospitals and catastrophic health expenses, pushing millions into poverty. While community health workers in many LMICs have achieved notable success, they often provide services like family planning or vaccinations only. Total healthcare needs of a family with infants, adolescents, adults, pregnant women, and elderly remains unmet. Community health workers lack innovation and support to provide comprehensive healthcare services to address the holistic family healthcare needs. What if healthcare wasn't just reactive, but proactive? The answer? IGP, the Intelligent General Practitioner Model by CMed Health. IGP equips community health workers with an AI co-pilot and point-of-care diagnostics, enabling personalized, comprehensive care at doorsteps. From health education and early screenings to triage, referrals, and follow-ups, IGP integrates comprehensive preventative and primary healthcare services with online and offline GP clinics, ensures doctor consultations, and referrals to higher level care as needed to enable equitable healthcare for all. For $1 per individual per month, IGP ensures affordable, accessible, and quality care. Doorstep services and IGP clinics can manage up to 90% of community health issues, reduce the patient load in hospitals, the burden of NCDs, along with maternal and child mortality. During 8 years of conceptualization and implementation, IGP model has impacted over 3 million lives with a 99.5% satisfaction rate. IGP aims to develop Medical GPT, an AI assistant for risk assessment and triage, clinical notes summarization, and second opinion systems with a resilient, data-driven healthcare ecosystem with financial protection. Be a part of our mission to create a world where everyone has access to affordable, timely, and quality healthcare towards universal healthcare coverage.
So you will be happy to know that all the solution we actually researched, innovated, patented, and commercialized in Bangladesh, which includes an AI engine that create health account for every citizen, develop electronic health record, do the periodic reassessment, triage, and generative AI like a medical GPT to answer any questions, which support multilingual, and everything is clinically validated, and it have the opportunity to support every rural areas, which an online and offline solution. And we are grateful to some funding from many organizations, including Gates Foundations. So it ensures that continuity of care. That means it ensures periodic preventive checkup to ensure healthy living. So periodic health checkup and managing healthcare in the primary care center. And when it's a bigger problem, they go to the secondary or tertiary care center. When they recover, all the information come to the systems and they have a periodic health checkup and advice. And which already you've seen that impacted and implemented in Bangladesh and India. We are now actually launching in Pakistan. So what we believe that human should be in the center of AI and defining role of human in the loop. So you've already seen that we're saying that healthy living, promotive, proactive, preventive, and primary care through AI system, which is called AI Copilot, IoT-based point of care diagnostic and generative AI. We are now building an AI solution for secondary, tertiary, rehabilitative, and palliative care with creating AI Copilot, which is clinically validated for the physicians, AI-based scribing system to generate health record, AI-based clinical audit system to reduce the diagnostic and the prescription errors, and ultimately AI-based second opinion systems. And we also having many other works, and we also created AI forum that which actually creating a responsible AI for all. And we believe that AI should not be in the city centers, it should be union to capital. That means rural to urban. So we actually helping organizations to building innovation ecosystems and customize AI training for every professions and helping you to grow their career, which would be AI ready. So we also working with University of Harvard to how to build a human-centered solution through AI, not only for our country, for any country around the world. And these are the like our collaborations we are doing together. We actually believe on the collaboration, partnership, co-creation to serve the humanity, where 7 billion people living in the developing country, they need our support. And I'm very open for collaboration and impacting lives of many people so that we can create a better world for everyone. I'm grateful to all the funders, all the collaborators, and thank you so much for listening. I'm happy to take any questions that you have. Thank you so much to everyone for patience listening. Thank you.
Thank you very much, Professor Mahmood sir, for your insightful presentation and valuable contribution. Now we are going to the question and answer session. Questions? No.
I think you can ask your question. One hand raised,
Yes, sir. Yes.
Can I ask one question?
please.
It is Dr. Abdul. I'm working as a consultant health initiatives, and my profession is pharmacy. What I think that health and well-being is just like a river, and if I say that one health is just like an ocean, so till now our Muslim countries they cannot improve their health system. How can we improve our ocean? This is very difficult. What's your opinion about this? Because in health there is health and well-being, while in one health is a four segments, you know very well: humans, plants, environment, and another fourth one is which one? Plants. Animals, plants, humans, and environment. Four segments. So it becomes in an ocean. So in health, still we are behind the information. Or if we say except Saudi Arabia, they have achieved a level 4 healthcare system, but others they are in infancy, including us.
So you are saying that our the problem is very big. We cannot solve it. I just want to get your precise questions.
It is very difficult. No, I want to say that health is. I say this is just like a river, one segment, and one health is just like an ocean. It includes humans, animals, plants, and environment. Already we have trouble in Pakistan to improve the health system, particularly in rural areas. Then about 4 segments, it will be very difficult for us.
Okay. I just want to address very shortly about your questions. Everything is impossible, but he who can see the impossible can make the possible. So we have to believe the people who are living in the OIC countries that we have the power to solve it. And you will be happy to know that we created our AI-based health system that impacted 4 million people and actually implemented in Bangladesh. And we just launched in India. We are going to launch in Pakistan in December. So what I'm saying that AI and our intellectual ability can help us to solve impossible problems possible, and we have to believe on that we can do that. Many impossible problems solved by the North people, and they actually didn't afraid of it. So we have to be collaborate and solving the problems. Thank you.
Thank you very much. Do Bangladesh have an artificial intelligence policy or not?
Yes, artificial intelligence policy in the process.
Okay, thank you very much.
Sir, we have
I am
another question from.
actively involved for fourth industrial revolution technology, including AI, for the policy and the sectors implementations.
My request will be, please design a framework not only for Bangladesh, but also make a design a framework for OIC 57 Muslim countries on AI policy.
Happy to contribute, and I need your support to do that. And I would love to work with it to contribute for OIC countries.
Inshallah. Thank you, sir. Sir, we have another question from Mohammad Tufail, sir, Program Manager at OIC Comstech.
Thank you so much for the nice presentation. We learned something very new from you regarding the AI. But my question is that particularly the OIC member states, like we have 57 member states, and the countries, most of the countries are underdeveloped nations. So like they don't have access for the basic education. And like how AI can revolutionize the education, and either the second part of the question is that if we bring AI without educating them, so it will be, for me, it's my opinion that it will be like the death of creativity for an individual. How you look at this OIC member states, particularly the underdeveloped nations?
Okay. So I just would like to address that AI would be the great equalizer. So any country who really want to make an equitable society, that they are like an underdeveloped country or developing country, they need to use AI, and they need to use their own AI. If they want to buy AI and like actually use it, that's going to be very costly. They're going to not afford it. So what they need to do, they need to take the expertise from within the developing country, like many countries who are advanced. We need to have a collaborations, and I have a policy and the framework how AI can equalize about the education. So I would love to contribute to actually empower, because my all the work is for the developing world and underdeveloped country. I always try to look at the problems that we face in many developing countries, how can solve it through technology and create equity in the society, and happy to collaborate and explore more and contribute.
Thank you.
Thank you, sir. Sir, we have a more three quick questions. One question is from Dr. Javed Kushi, sir. He will ask you the questions.
I'm Dr. Javed Kushi, consultant here at Comstech. The options given by you are very good. They are fantastic to learn, but we don't notice that we have problems. Problems in a sense. My question is a little bit related to the question before. If you are talking about the health facilities, you know, we had a conference 10 days ago, and we were discussing the facilities in the 57 OIC countries. And it was very difficult even to say that some of the countries have the facilities of healthcare facilities. So in the education is down, there is no healthcare facilities, and then we think of applying AI facility, AI technology to the one healthcare facilities and to bring them together. Even it is for the developed countries, it is difficult to understand what is one health. And they are trying to understand what is one health. And even applying to AI to those countries which don't know even the spellings of AI, what it is used for. So we have, my thinking is we have to think from those countries which can use it, not from all the OIC countries.
I totally agree. I just want to add with you what you said, that one of the biggest problem of our developing country, not only OIC country, that we don't believe ourselves. We always depends on foreign technology and foreign expertise. And we have to mix it with a foreign expertise and our local expertise, and believe ourselves that we can solve our problems and scale it. If we can solve it and scale it, that will be cost effective and sustainable. So I'm sorry to say that should be I am last 11 years working on that and developing solution for real life problem and implementing in the field. So based on the experience, I want to add that. Thank you.
No, I didn't question that you are thinking. I questions the problems lying there. See, the definition you have given that we can do it on our level. I'm for that we should do it on OIC level. But my question is little bit related that how we are going to apply this important technology, which has a background of learning and education and One Health to bring all those countries together. We should make this for our OIC countries, but we should divide these OIC countries in different tiers and then we apply from one tier to other tier and then bringing them to level. We cannot apply them all together.
I totally agree with you, and I'm very happy to collaborate and contribute, and we can have a long discussion and make a plan for it. Thank you.
Thank you, sir. We have one more question from Professor Dr. Hafizur Rahman, sir. Sir, please, you can ask the question. Professor, sir, Professor Dr. Hafizur Rahman, sir, please, you can ask the question that our honorable speakers.
Unmute your.
Dr. Rahman, you have to unmute.
You have a question on chat box.
Yeah, you want to ask, but I will already say
This question. How can this
Okay.
technology?
Sir, we have another question from Hadia Khan. He asked, how can this technology be made accessible to rural areas, and how will it be implemented in Pakistan? Furthermore, how can students at a start level contribute, learn, and add to this case?
So, like one thing I just want to add that for the OIC country or any developing country, our technology should be affordable and that should solve our problems. And that's why we need to develop the solution according to local context. As you said that in our healthcare solution, that only $1 can have a comprehensive healthcare that we can get. So in that way, we can go for education, and thus when we develop the solution, we found that in rural areas, internet is not stable. We then redesign our solution that is useful. So like every context, every culture, and every region is different. So we have to localize and contextualize the solution. That should be my answer. Thank you.
Thank you, sir. Thank you for your excellent engagement. Due to the protest, Professor Dr. Murtuza Nazamat Ali is unable to join with us. So now I would like to go with now I would like to invite Professor Dr. MD Muhammad Moizul Hassan from Haji Muhammad Danis Science and Technology University, Bangladesh, to deliver his talk on enhancing agriculture ecosystem resilience through AI, a on-health perspective. Professor Dr. Hassan has made important contributions in implant pathology with focus on implant disease management, biocontrol, and sustainable farming. His research has significant advance in management of plant disease in Bangladesh. His study on phaeophysis blight in eggplant utilized bacteria isolated from plant rhizophoria to develop eco-friendly and long-lasting disease control.
Slide দেখা যাচ্ছে.
Yes, sir. Methods. He has also conducted impactful work on what disease such as biopolyarsis, leaf blight, providing valuable insight to reduce yield losses and enhance weight production. Sir, the stage is yours.
So, assalamu alaikum. Do you hear me? Okay.
Yes, sir. Yes, sir.
Welcome all of you. I am very much grateful to Cosmotech and YC to invite me. to join such prestigious webinar. So I welcome all of you to my presentation. So I'm Dr. M.D. Mohidul Hassan. I'm from Haji Muhammad Danish Science and Technology University, which is located at very remote place of Bangladesh, very northern Bangladesh. So I want to talk about enhancing agricultural ecosystem resilience through AI, a One Health perspective. Okay. We all know about the One Health program. So One Health program, we know that it integrated or unified the approach that recognizes and the close and interdependent links like health of population, people, health of animal, and health of environment. And we all know, we already know that what is artificial intelligence, but we can conclude in that way that what about One Health program? So we people like in our South Asian countries, we think about only the health of the people, but very rarely we think about the health of animals, plants, or ecosystem. So our point is that if we think about the One Health approach, we have to disseminate this kind of information to the rural areas of farmers or peoples like that. So One Health not included in only in case of human health or animal health, but ecosystem is a very important part of that program. So in that case, the agriculture, we think that it is the core part of One Health program, because this one linked the health of the people, health of the animals, and health of the environment. So however, the complexity and scale of these challenges demand advanced tools for data collection, integration, and analysis. So that's why where artificial intelligence that may plays an important role, transformative role to accommodate all that kind of issues. So artificial intelligence that may enable the processing of vast and diverse data set. We already know that that may come from the genomic sequencing, climate model, and veterinary surveillance to electronic health record like the real-time sensors. So in the agricultural and veterinary sector, we call that AI may support the precision of livestock farming or automated disease diagnostic systems and monitoring of animal welfare. That are the essential component of the One Health framework. Similarly, if we can say about the environmental health, in case of environmental health, AI may aid in the detection of pollution modeling, ecosystem changes, and assessing their implication for both animal and human. So by linking the human medicine or veterinary science and environmental monitoring through intelligence system, AI may strengthen the operationalization of One Health program that may enable faster decision making, targeted intervention, and sustainable health solution. Thus, the synergy between One Health and AI may not only improve the preparedness and response to health threat, but also foster a holistic vision of global health security in the 21st century. So, by connecting diverse data stream, AI may help us to understand the complex relationship and make proactive data-driven decision to improve health outcome across all the 3 domains. So artificial intelligence in the recent year, the agricultural sector, like our country, that are facing numerous challenges due to growing population demand, climate changes, and resource constraint. To tackle this issue and to ensure the sustainable food production system, farmers and researchers are turning to cutting-edge technologies like the artificial intelligence. So, like the agricultural-based country, Bangladesh, AI may has the potential to revolutionize the farming industry. We can make more efficient agriculture, a more effective, cost-effective, and environmental-friendly agriculture by the use of artificial intelligence. So, in our country like Bangladesh, India, or Pakistan, AI may cause the revolutionary changes by enhancing the productivity, sustainability, and resilience. This system support the modern agricultural system we can call the precision farming. This kind of precision farming help to optimize the use of water. We all know that we have the deficiency of water that may optimize the use of fertilizers and pesticide based on real-time field data. So we all know that machine learning algorithm, this kind of algorithm that analyze the satellite and drone imagery to detect the crop diseases, pest and nutrient deficiencies in the early stage of the crop production. So by enabling timely intervention, this kind of AI will help to precise the agriculture. In case of livestock farming, we can say that AI-driven sensors may monitor the animal health. They can monitor the feeding and welfare of the producing by reducing the disease risk. Another thing is kind of the predictive analysis that may help forecasting the yield, or they can forecast the market demand and climate impacts. So they can also may guide the better decision making so that overall AI can minimize the cost, they can minimize the cost, they can improve the efficiency and contribute to sustainability of the food security. So the modern concept of agriculture is the AI-driven agriculture, or we can say that precision agriculture. In another word, we can call that one smart farming for optimization of the yield. So AI-driven technologies that are helping farmers to effectively use the precision agriculture to make practicable about the precision agriculture by the using of collection of data and analysis of data. So we can say that the AI technology may help to use the drones or satellite imagery and the sensor. By this way, we can monitor the crop soil condition even, or we all know that weather pattern in the real-time manners. We can collect all the information by using the AI system. So in modern farming approaches, this technology usually we use to optimize the data, and by improving efficiency and sustainability, that precision agriculture address the global challenges such as food security, climate change, and resource conservation, shaping the future of smart farming. So what are the technology we can use in case of smart farming? So smart farming relies on advanced technology to improve efficiency, productivity, and sustainability in agriculture. One thing we can say that IoT, that is Internet of Things, that device and sensors may monitor the soil moisture, temperature, and crop health in real time. Another one thing is a GPS or GIS. GPS, that global positioning system or global information system that may support the precision field mapping and resource optimization. Drone and satellite imagery that may help in the crop surveillance and disease detection. Artificial intelligence and machine learning analyze large data set for predictive insight on yield, pest and climate impact. And automation and robotics that may enable precision seedling, irrigation and harvesting with blockchain, ensure transparency in food supply chain. Together, this technology that may transform traditional farming into the data-driven or sustainable agriculture. So one of the most important things is the detection and monitoring of crop diseases in the field level. So that AI, that powered computer vision system that can analyze the image captured by the drones or smartphone to identify the subtle sign of the distress in the plant. That through the machine learning algorithm, this system may detect the disease at an early stages, which help us to prevent their spread and enabling farmers to take prompt corrective action, so that people can take action to prevent the dissemination and spreading of the diseases at the early stage. This kind of proactive approach that not only the saves of crops, but that may also reduce the need for excessive pesticide use. So this kind of transforming crop monitoring and disease detection by enabling precise real-time analysis of plant health. This allows farmers to take timely targeted action, reducing crop loss and minimizing the chemical use. So this kind of AI-driven predictive model may also optimize irrigation and fertilization and harvesting schedule, enhancing yield and sustainability. Overall, that AI may ensure smarter, more efficient, and eco-friendly crop management. And obviously, the automated farming operation through the AI may help reduce the reliance on human labor and minimizing the operational cost. This kind of equipped machinery with AI can perform tasks such as planting, harvesting, and weeding. This may help to reduce the cultivation cost of the product and may increase the production, and they will ensure the sustainable agriculture. These kind of things may not only improve the productivity, but may also free the farmers to focus on higher value activities like strategic planning and market analysis. So we all know that weather has a direct relation with the development of plant diseases. So by using the AI, that can play a crucial role in the predicting the extreme events that may help farmer to adapt the changing condition. So if with the help of artificial intelligence, farmers came to know that there is a chance to development of an epidemic disease, they can take the alternative steps to prevent the diseases, or they can go for another option to avoid that epidemic disease, or they can go for another effective control measure so that they can minimize the crop loss. So this kind of knowledge farmers can directly apply in their field directly, so that they can minimize the losses and they can maximize the productivity of the crops. And this kind of data-driven decision that may leverage the analytic tools, farmers can make data-driven decision based on trend, pattern, and insight. So this may also enable to optimize the resource utilization, implementation of efficient crop rotation strategies to control the plant diseases, to prevent the plant diseases to break up their life cycle. And obviously, it will help to plan the better for the future. And one of the most important problem in our country, like Bangladesh, the optimization of supply chain. Because of supply chain problem, that is from farm to the market, this kind of advanced algorithm can analyze the market demand, so that farmers can produce according to the demand. Whatever they want to go to cultivation, they first analyze the market demand, and they will go to the cultivation of this, then that kind of crop. Another problem like our country is that the transportation logistic. So we have shortage of that kind of facilities, but AI may help us to improve this kind of transportation system. And this kind of inventory level may optimize the distribution process. And by optimization of this kind of AI-driven process, that maybe will help to reduce the food wastage, or they can even may improve the shelf life of the perishable produces, and they can offer the better cost management throughout the supply chain. So I'm the worker, or kind of want to do some research in kind of management of plant diseases. So farmers usually lot of chemicals to control the plant diseases. This kind of indiscriminate use of chemicals or fertilizers that are creating problem in case of environmental sectors, or even human health of the human population. So our approach is to attain the One Health program, but the indiscriminate use of chemicals or fertilizers, this is creating a lot of problems in case of ecosystem. So if we can turn our agriculture from chemical to the biocontrol strategies, that may help us to the improve of agricultural ecosystem, or human health, or even animal health. So our approach nowadays is to reduce the use of chemical by replacing some biocontrol agents. So AI, artificial intelligence, also have the direct relationship with the biocontrol of plant diseases. So AI may help to produce a powerful biocontrol agent to accelerate the research, to optimize the management, and to improve the effectiveness of the biological solution. This kind of AI system, they can analyze the complexity of the biological data to identify the pattern or prediction of the disease outbreak. And they can also guide the development of targeted biocontrol agent and strategies. This kind of approach that may help to make the agriculture more sustainable and efficient. So from the beginning to the making of biocontrol agent to the commercialization, so AI may directly help in each and every steps of that chain. So we need to isolate the biocontrol agent from the soil or from the plant source, like even we can isolate from the atmosphere. So in each and every steps of the bioformulation production, AI may help to improve in front of stress condition, or they can help in the system of production system. They can predict the mode of action and risk. They can analyze the risk assessment. So by doing this one, AI may help us to produce more sustainable, more effective biocontrol agents. So as our target is to reduce the use of chemical fertilizer and increase the biocontrol like that, or biofertilizer, this kind of product. So we want to commercialize, we want to product this product, this kind of product and commercialize, and ultimately we want to help the people to prevent their crop from the disease and pest, to prevent the environment, to prevent their health, to prevent the animal health, this kind of thing. So artificial intelligence may help us to produce this kind of biocontrol agent that may offer us a sustainable agricultural system. So like our country, there is so much challenges of introduction or using of AI in agriculture. Usually the agricultural data are not consistent. They are changing in every moment like that. So AI may not give us sometimes the precise data because of the incompatibility of agricultural data. So investment of artificial intelligence in the agricultural field, it needs a lot of money. I don't have actual idea how much investment it required, but usually people's or farmers are low income people, so they think this is takes lots of investment. So this is one of the most drawback in our country to use AI in the agricultural field. And farmers or people start thinking who will be the ownership of the data. The question even about who owns this data, that data driven by the AI, or how it is stored, and what whether farmers they will have any control over this data, or in future they can use these kind of things. They are usually remains in their mind. And AI powered tools requires constant internet connectivity. As we have limited internet connectivity throughout the country, that make that is the key drawback in rural and regional areas. So without that stable internet, that real-time AI capabilities are difficult to implement. That may hinder the implementation of precise farming in our country. And obviously, there are some technical complexity and skill gap remains in our farmers' mind, and we have limited localized solution problem, because if AI has some problem, they have some technical problem, there is a lack of problem of expertise in our country like that. So as a whole, we can say that AI that may help reshaping the farming industry, that make it help us to make the more sustainable agricultural productive system. And this kind of precise agriculture or early disease detection or automation system, or the forecasting of weather data, or any data driven decision making, that will help us to tackle the challenges that is posed by the growing global population and climate change. So this kind of AI in corporation in the agriculture sector, that will not lead to the increased yield, but that will also help to reduce the resource wastage. And as the potential of AI continues to grow, it is essential for policymaker, researcher, and farmers to collaborate and explore innovative AI-driven solutions to nourish the world in the years to come. So I will not take so much of time. Thank you very much for your patience hearing. I thanks all of you. Thank you very much. Assalamu alaikum.
Thank you, Professor Dr. Hassan, for your excellent presentations. The floor is now open for the question from our participants. Thank you, sir. No question. Sir, we have no questions. So thank you so much, sir. Your excellent presentation and thoughtful presentation to sharing your knowledge with us.
Okay,
Now,
thank you. Thank you very much.
Thank you, sir. Finally, I would like to invite Professor Dr. Kazi Abdus Sabur, researcher at Bangladesh Institute of Innovative Health Research, to present on AI for ensuring safety of animal organ foods, a One Health approach in developing countries. His expertise in zoonotic disease, antimicrobial resistance, and vaccine development reflects his strong commitment to advancing the One Health visions. Professor Dr. Sabur is also passionate about sharing science, explaining complex research in simple way, and inspiring young students across the region. The floor is yours, sir.
Assalamu alaikum. Am I audible?
Yes, yes.
Okay, thank you. Today I want to share about AI applications in One Health. I especially focus on the antimicrobial resistance and food safety perspective. Good evening, everyone, and thank you for joining this session, and thank you, comstech, for inviting me to this nice session. Is my presentation visible?
Yes.
Okay. Today I will be discussing how the One Health approach and artificial intelligence interact to combat the One Health, the most pressing issue of global health, the antimicrobial resistance. This talk aims to explore how integrating human, animal, and environmental health through AI-driven innovation can make food systems safer and extend our capacity to detect and prevent emerging threats. And now, what is the One Health concept? One Health concept is the multi-sectoral and multidisciplinary approach in public health worldwide. Here, Professor Mamun from computer science, Professor Hassan from agricultural science, I am from veterinary science and public health. We are multi-sectoral people are combined in a platform. This platform is called One Health. It concerns human, animal, and the environment health in one umbrella. And human, animal, and environment health together work as a natural phenomenon from the ancient period. But we now, for the industrialization and the urbanization, we create a artificial barrier among the human, animal, and the environmental health. And the One Health is working to disseminate this artificial barrier and taking all the health, human, animal, and environmental health in one platform. And World Health Initiative represents a global strategy advocating for a transboundary and transdisciplinary approach to gathering expertise from multiple sectors to address and solve the health problem of human, animal, and ecosystems. Because the disease has no boundaries. We human have boundaries, but the disease has no boundary. If we control those diseases, suppose COVID-19 teaches us that COVID-19 has no boundaries. So we should follow the One Health approach. And here a data show that 60% of existing human infection diseases are zoonotic. That means those diseases come from animal. And the 75% of emerging human infectious disease have an animal origin. That means first the disease from animal and then human are infected, as bird flu, swine flu, they are animal diseases and human are infected. Rabies, they are animal diseases and human are infected. 5 new human diseases appear every year, and 3 of them are animal origin. And 80% of agent with potential bioterrorist use as zoonotic pathogen. So what is the global challenge of antibiotic resistance? We all know that the modern antibiotic era begins with the Alexander Fleming discovery of penicillin in 1928 and saving millions of people in world war. And antibiotics, widespread antibiotics has used, and after 100 years, and 1928 first antibiotic was discovered, and now 2025 we also lose the capability of our antibiotics before 100 years. And widespread antibiotic use has led to emergence of drug resistance pathogens and the rise of super resistance bacteria, which is called superbug. And if we focus on the global impact of AMR, there are expected 10 million deaths per year by 2050. Here millions of deaths saved by antibiotic, now they are destroy million of deaths. Estimated economic cost around 100 billion annually. So we should require urgent action to solve this issue. And here is a fluoroquinone resistance E. coli in 2019 from Lancet. Here we found that our Bangladesh, Pakistan, and India, around 80% plus antibiotic resistance E. coli found in this region. And if you show that in the map, there are the OIC country in some African regions are also showing more antibiotic resistance pathogens. And how the ecosystem linkages in antimicrobial resistance. Usually we use antibiotics in livestock, and the resistance bacteria in feces, and then soil and water may be contaminated by those bacteria. And then we consume the animal originated feed, such as meat, chicken meat, milk, and eggs. Those are containing the resistance bacteria, which are used in livestock. And then AMR is spread through the irrigation, agriculture, and crops. And they are continuously traveling from environment to animal to human, and then human to animal to environment, and vice versa. And here are some antimicrobial resistance data from animal originated feed. Here you can find that chicken meat found E. coli, ampicillin 100% resistance, erythromycin resistance, and another research also penicillin 100% resistance. In there, one of these heat map show the resistance pattern of this antimicrobial. And this is some of the research data from India. Here you show that raw meat, chicken meat, poultry meat, raw and seaborne meat, all are antibiotic resistance. And there are some data from Pakistan and Nepal also. And you can so that every country has showing this problem nowadays. And how artificial intelligence can deal with this problem. Artificial intelligence detect AMR hotspot at temporal trends, and machine learning models predict emerging resistance. Which bacteria growing showing resistance pattern, and which antibiotic are prone to resistance in some few days. Machine learning models can predict those emergence. And AI images tools identify microbial contamination in food, like the contamination of food particle, because the food is the major source of human intervention with the antimicrobial resistance. And natural language model also used for this detection of antimicrobial resistance. And there are some methodologies which can be used in food safety and AMR. We can use machine learning to predicting antimicrobial susceptibility using genomic data, and we can use deep learning identifying bacterial colonies or spoilage food images, and we use natural language processing, and we use IoT, Internet of Things, and sensors. And here is the main ocean of the One Health approach. We as a researcher in veterinary field and the public health field, we can find this idea where we can use machine learning, and the people who are working on the artificial intelligence, they can also use those data to making the machine learning tools or deep learning tools or natural language processing tools. And together we can combat with this challenge. An AI-enabled food safety monitoring system can be used for controlling the high probability of antimicrobial resistance in food, like Internet of Things sensors detect contamination in food facilities, and image recognition detects spoilage or microbial growth, with machine learning model can be used, and predictive analysis embedded early contamination warning, and the blockchain and AI enhanced supply chain traceability, which all together jointly combat against the antimicrobial resistance. And this is a research from the Pakistan, Professor Rizwan and Nasim. Here they show that artificial intelligence, how can we use in machine learning, deep learning, natural language processing, computer vision, and predictive analysis to our supply chain management, contamination detection, hazards to food safety, and quality control, and consumer safety. If we apply all those systems, we can found zero contamination food. And we can use AI for AMR surveillance under One Health approach, integrate human, animal, and environmental AMR database, which veterinarians are use antibiotics, humans are use antibiotic for their treatment purposes. So if there are an integrated database, they can know about what animal are uses antibiotic, and you know that there are a withdrawal period of antibiotic after application in animal. There are withdrawal period depending on the various types of antibiotics, 7 days or 14 days. When the milk and the meat contain the residue of this antibiotic, if the animal is slaughtered and the milk or meat is consumed, then we are prone to infected with the antimicrobial resistance bacteria. And we predict resistance emergence and transmission pathways, how they are transmitted from human to animal, and which bacteria transmitted where. And AI model are used, blockchain model are used here, and prioritize high risk zone for intervention, where we should take immediate action, and where action required for which antibiotics, And we also calculate this by using AI models. And policy dashboard supply data driven decision making also AI implemented should be used to solving this problem. And here is the another study, research study, where using machine learning and deep learning models in AMR identification. Here they collect data and the quality of genomic assembly balanced dataset they are prepared, and genes, KMR and susceptibility resistance, and deep learning and machine learning model were applied, and we found the result, and the test model can be applied for further study. And which is the benefit for AI integration? The laboratory-based testings in the rural areas is quite impossible in Bangladesh, Pakistan, India, or most of the OIC nations. So by using applied AI integrated model, we can detect faster outbreak detection and control, and we share data across sectors, instance One Health collaborator, and we reduce burden of foodborne disease, and we enable evidence-based antibiotic policies. And there are some policies, WHO Global Action Plan on AMR, and FAO's Progressive Management Pathway for AMR, One Health Joint Plan of Action, and I have not found there are any plan for OIC countries prepared by OIC or comstech, but there is a great scope to collaborate in One Health model, where veterinarians, that means animal doctor, human doctors, and the data scientists, computer scientists, and environmentalists all can collaborate in a platform. And if we discuss about the future direction, we should develop a regional artificial intelligence-based antimicrobial resistance surveillance network and build capacity in data science and bioinformatics, which Professor Mamun addressed previously. We must rely on our own data, and we must develop our own AI model. We should not based on the others model. We must develop our own model for Muslim countries in OICs. And foster government, academia, industry partnership is very important for combating this issue. And we should promote AI-driven early warning systems for foodborne threats. And in the conclusion, if we sum up that AI shows major promise in addressing AMR challenges in recent days. So we should application AI in the antimicrobial resistance control, including sequencing-based artificial intelligence model to detect resistance genes, and clinical decision support system using real-time hospital data. And we also artificial intelligence assist antibiotic design and synergistic drug discovery. And if we use those AI, we can faster detect the resistance strain, more rational antibiotic use, and enhance predictive models for AMR trends. And thank you all. This is my presentation.
Thank you, Dr. Sobur, for your excellent presentation. Now floor is open for the questions. Yes, sir. Please, you can ask the question.
Thank you very much, Ajit Sabur. Very informative presentation on artificial intelligence-based One Health. This is just for your information. I was part of Global Health Action Plan, which were mentioned in Global Health Action Plan 2014 that was held in Oslo, Norway. I was representing government of Pakistan, and it was approved and notified by World Health Assembly in 2015. Today, WHO has notified the antimicrobial resistance surveillance, and the data has come on individual country basis, including Pakistan and also the Bangladesh, the other American countries and for the world, 6 regions of the WHO. Definitely what you have identified that antimicrobial resistance can be identified through with the support of artificial intelligence. This is very, very comprehensive and very fruitful for us. But the Pakistan-like countries, they don't even recommend to they send the samples to laboratories for culture sensitivity tests. So first thing is that we should educate, train, and develop the capacity of healthcare professionals, physicians, that they should send a sample for antimicrobial resistance to the pathological lab. And then the second one is that we shared OIC countries, we are 57 countries, but it is not possible that 54 countries have the same health system, especially in One Health. So among 57 countries, we have OIC 15 dialogue platform, in which there are 15 Muslim countries, and we think that they have better health systems, not only in health but also in One Health. There are Arab countries, including also beside Arab countries, the other countries in OIC 15 dialogue platform is Bangladesh, Pakistan, Indonesia, Malaysia, Turkey, Iran, Egypt, Morocco, and Azerbaijan, and some other countries. So at least these 15 countries, they should make a framework that how we can use artificial intelligence in One Health. Then it will be, I think it's more beneficial for our 15 countries.
Yes.
What's your opinion about this?
Thank you. It is happy to know that you are collaborator of AMR action plan, and this is a good proposal. If the 15 countries among the 57 countries of OIC can make an action plan or AI-based model to detect the antimicrobial resistance, and there are halal market in the Europe and other countries where the antimicrobial resistance beef, meat, and eggs, milk are one of the major problem to export them from the Muslim countries. If we collaboratively work on those issue, and we can focus those issue, and then we will be do for our economic also and for our national people health strategy. Thank you, Professor.
Thank you very much.
Thank you for your great discussion. With this, we conclude the technical session of our webinar. Now I have the honor to invite Professor Dr. Ismaila Diallo, Regional Advisor for YC Africa and Head of Science, Technology and Innovation, STI Policy Research and Training Center, to deliver the vote of thanks. Sir, the floor is yours.
Thank you, Mr. Rakibul. Artificial intelligence to combat climate change and promote environmental sustainability is also at the heart of the medicine of the future. With assisted surgeries, remote patient monitoring, smart prosthetics, and personalized treatments. the concept of One Health in the digital world, creating an integrated approach to address challenges such as zoonotic diseases, antimicrobial resistance, and vector-borne diseases. Artificial intelligence fosters the interconnection between crop, animal, environmental, and human health to create more stable agricultural systems in the face of climate and health shocks. Faced with the complexity of globalized supply chain and the constant need to prevent public health risks, artificial intelligence helps achieve the zero contamination standard by strengthening quality control protocols and optimizing interventions in the event of identified risks. Any use of artificial intelligence in ecosystem resilience implies a commitment to using responsible artificial intelligence for transparency, accountability, inclusion, and governance to support societal trust and the continuous improvement of communities. Thank you for your attention.
Thank you, Professor Dr. Ismail Agiala, sir, for your enlightening talk on overall the perspectives. With that, now we officially conclude today's webinar. We hope this session has been insightful and productive, and we look forward to our engagement in future comstech activities. We are very grateful to all the resource persons for their valuable contributions, and all the participants will receive their certificate of presentation via email within next 2 or 4 days, inshallah. Thank you so much.
Online participant. Thanks for online participant.
Thank you for all. Thank you for the all online participants to joining here and listening our valuable speech from resource person. Thank you all. Thanks.
Thank you.
Thank you.
Thank you all. Thank you.